And it was a man in his 60s who was overweight. He had COVID-19. He had been fully vaccinated. And I went to see him in his room, and he was wearing an N95 mask. And you could see the sheer terror in his eyes. He was absolutely terrified. And I told him, I said, take off that mask. And I wasn't wearing a mask. I've already had COVID-19. I can't get it again. He goes, you're not wearing a mask. I said, it doesn't matter. I can't get it. And I can tell you, I saw him a week ago and I don't have a COVID-19. Once you're recovered, you can't get it again. And to just get him to take off his mask, open the windows, and reduce the anxiety. In mild cases, honestly, I think some of the nutraceuticals and supplements and just compassionate care and reassurance took someone who was destined to be a hospitalization. Because there are data from the paramedics run sheets in Seattle and other counties in municipalities that a lot of patients go to the hospital. They're not in severe respiratory distress. They're just in sheer panic and fear. And just by compassionately taking care of patients, I think if we had a national phone call program and we just called our high-risk seniors and kind of walked them through this illness, we could drop hospitalizations dramatically. But as you alluded, the Delta variant does seem harder to treat. It seems to be a longer illness. And I think one of the reasons why is the viral loads are so high. And that's partly because the vaccines are only partially effective. And so the vaccinated state seems to be allowing very high carriage of the Delta variant. And our CDC directors come on TV and told us that. Papers by Fahrenholt and Venkata Krishnan and by Chow, you can find all those first authors are reporting, and Louis, actually from China now, has reported these very high viral loads. I personally underestimated how difficult the Delta peak was going to be for us, just because I didn't anticipate that the vaccinated could get Delta as readily as they are. And then also the viral loads being as hard. Now, the good news is that it looks like we've rounded the peak of the Delta outbreak and we're on the way down now. And as things come down, I think we'll see these anxiety levels come down. We'd like to see a kick in of the oral nasal hygiene program, and we're behind on that. They've been doing that in other cities. I mentioned povidone iodine, but if someone's iodine allergic, dilute hydrogen peroxide works. It turns out that even dilute sodium hypochlorite or a few drops of household bleach works in the nose and is very, very effective. And then least effective is Listerine, but you can still use it. The American Dental Association recommends oral nasal hygiene for cytomegalovirus and for Epstein-Barr virus. And because just like hand sanitizer, any form of hand sanitizer kills the virus easily, we want to see everybody get into oral nasal hygiene to cut down these high viral loads we're seeing with Delta. Twice a day helps prevent acquisition of COVID-19 in randomized and prospective studies. And then during the active phase, doing it 2 to 4 times a day cuts down the viral load. I learned this from anti-infective dentist Paul Gossett in Chicago. Paul recently told me he says that there hasn't been any dental outbreaks all year long, and I think he's right. And dentists have been in the mouths of people, he says, because the dentists and hygienists routinely do this. But he recently had a patient who came in and she was feeling a little sick. He worked on her mouth and he does his normal program, and she gave him a call back and said, you know what, I feel terrible. I have COVID-19. He put her on a 4 times a day dilute a povidone iodine and just the nutraceuticals. She was young. She rapidly cleared the virus. She never really got sick. He increased his prophylaxis. He didn't get sick either. So oral nasal hygiene, I think, is a big update. And then the medicinals. I'm not too worried about ivermectin or hydroxychloroquine. Honestly, if there's drug shortages or other restrictions, we can utilize the other medications.
Dr. McCullough, I cannot tell you how encouraging that is. That is so encouraging. And I hope our viewers are listening and understand how significant what Dr. McCullough just said. I think all of us can get access to iodine and some of these very other simple things that you talked about. In fact, I have to say, you advised me to use the Listerine, and I noticed a dramatic improvement myself. I had a sore throat. It wasn't, you remember we talked about that. It wasn't going away. I had been gargling with lemon juice and some other things, and it just wasn't working. And when I switched to Listerine, I switched it to 3 to 4 times a day. My sore throat went away. So I really do find it to be quite impressive.
Yeah, that's good to hear. Now, sometimes people say the povidone iodine, they don't like the brown solution. So I recently had a patient, And he goes, Doc, I just can't bring myself to do it. I said, listen, just a few drops, very dilute, do it, spit it out, and then you can follow it up with Listerine to kind of freshen up your mouth after that. And he accepted that and it worked well. And you know what? He had a mild case. He's back at work. Thank goodness, nothing progressed. We're learning a lot about COVID-19. We have to be adaptable. I think the oral nasal hygiene is a big update, and the fact to be flexible with the drugs.
I'm very, very excited to introduce Dr. Sandoval. Dr. Sandoval, we look forward to hearing what you have been doing at UT Pines. You've been doing some amazing things with a lot of COVID patients there, and we look forward to hearing that.
Thank you very much. Yes, it's a pleasure to be here and to be able to share. And looking at a number of different things that we can do naturally. When you look at the NIH COVID-19 treatment guidelines, there are no recommendations for pre or post-exposure prophylaxis. In other words, to prevent before you get exposure or after you have exposure. There's no recommendations for treatment of symptomatic COVID-19 infections until one needs to be hospitalized and on oxygen. So really, there's nothing as far as guidance before that time. And so what we want to do is we want to fill in that space and say, okay, well, so you don't have to be hospitalized, you don't have to be on oxygen yet. What can you do? And we do have experience of treating a number of patients here on campus, close to 100 that have had COVID, and being able to help individuals through that situation. And one of the primary things is prayer. We always pray with individuals. We ask the Lord to work abundantly and mightily. We understand that He is the healer, not us. And so we want to cooperate with Him, and we want to cooperate in the things that He has given us to use. And so there are a number of things that we do recommend for individuals when they are beginning to get sick. Now, a key to treatment is begin right away. Begin right away. Once you have symptoms, you want to jump on things right away. Now, a package of things that we typically use here on campus with the individuals is vitamin C on a daily basis, zinc, and quercetin, because quercetin, it's an ionophore, helps the zinc get into the cells and increase its capacity to help with that antiviral components. Echinacea has been shown to be very good with other viral infections as well. And then vitamin D. Vitamin D is really important. And most individuals in the United States are fluctuating around 20, 23 as far as vitamin D level is concerned. Ideal is really around 60 to 75. And so it needs to be much higher. And so most individuals can tolerate about 50,000 international units a day for about 3 days, and then 10,000 international units after that. That's if anybody is deficient or in the low normal range. Now, if you've been supplementing for a while, I wouldn't recommend overdoing things because you can overdose on vitamin D3. It's a fat-soluble vitamin. And so it can fat accumulate, and then you can have toxicity issues related to it if you really overdo things. But it would be good to know what your vitamin D levels are and kind of work from there, especially with a healthcare provider. There are other things that we can look at. Something that we use with everybody is nature's penicillin. What that is you get a grapefruit, 2 oranges, a lemon, 3 cloves of garlic, a half an onion, and 3 drops of peppermint oil. And what you do is you just peel that color part off of the skin, not the white pulp behind it, but just the color part off the skin of the grapefruit, the oranges, and the lemons. Peel it, cut those, put them in a blender, blend them all up, everything in there, and it makes a nice little slushy here. And keep it refrigerated and drink about a cup of that throughout the day. That tends to be helpful as well. Now, when somebody comes down sick, one of the first things that we run to from a hydrotherapy standpoint is a fever bath. And a fever bath is really seeking to cause an individual to have a fever. There are a number of benefits associated with fevers. Heat shock proteins that are produced with a fever have immunologic benefit associated with them. It helps to increase the number of receptors for your innate immune system. It increases monocyte levels and function. There's increasing phagocytosis, cytotoxic T lymphocyte activity. There's benefits associated with it, cancer as well, research from there. But there's a lot of immune benefits associated with having a fever. And hence, when an individual gets sick, many times a fever is a response, and that's a defense mechanism. It's important. And it's important not to bring that fever down unless it gets to really high levels. So with a fever bath, I'm just going to describe it briefly, but down here you see a link, ugpines.org/COVID-19. You can go there, and there's more detailed instructions about how to do these things. Briefly, it's basically getting somebody in a bath and with hot water and increasing the temperature to a fever level. We usually aim for about 102 to 103.9 as far as oral temperature is concerned, and maintaining that temperature for about 20-30 minutes and then cooling an individual down. Now, of course, there are reasons why you would not do this. Somebody that has congestive heart failure, somebody that has bad coronary artery disease, so if they go jogging, they start getting chest pain. This is like causing somebody to jog. It's vigorous as well. And so if you have somebody that's very frail or they're very heat sensitive, then those are individuals that you might not want to do this with. And it should be with somebody that's doing that treatment on you rather than you doing it by yourself, because sometimes people have passed out, and that's not a good idea for you to be in a tub alone and pass out. That would not be a good thing. So it's increasing that temperature, keeping it up, and then cooling an individual down, and then helping them to bed and helping them to rest a while afterwards. We usually do this on a daily basis at the beginning of an infection. And again, recently we've had this surge here as well. And we've had a number of people on campus coming down, including individuals in their 80s. And with this surge, everybody has done well. We've gotten everybody through without hospitalization or any serious complications, except for some, pretty significant fatigue. Now, another option, and individuals might get a bit fatigued with the fever treatments, and so a few days into the treatment, they might not want it or tolerate it well. We usually switch to a contrast shower at that time. It's very simple. It's about 3 minutes of hot water on you, about as hot as you can stand, and turning around like in a rotisserie so you can get all sides of the body, and then you switch it on cold, and you do the dance and the tight breathing and so on for about 30 seconds, and then you turn it back on hot for about 3 minutes, back on cold for 30 seconds, back and forth. 3 exchanges, better even 5, and you can push it even to 7. But by the time you're getting 5 to 7, individuals start to get really tired. And you got to watch out for individuals becoming weak and falling in the shower. So a shower chair could be beneficial. Having somebody next to you and making sure that things are going well as well would be good. And then, of course, resting in bed for an hour afterwards and making sure that you stay well hydrated and drinking lots of fluids. Another thing that was already mentioned is a general revulsive, which is where you have a hot application to the front of the chest, you have a hot application to the back of the chest, and then you have the feet in hot water. And then the individual would be covered, of course, and you keep this hot on the chest for about 3 to 5 minutes. And then you take it off and apply an ice water cloth to the surface of the chest for about 30 seconds or so. And then the heat goes back on for 3 to 5 minutes, and then 30 seconds cold, 3 to 5 minutes hot, 30 seconds cold. We do this for about 5 to 7 exchanges, making sure the individual's head stays cool, that you give them water to drink in between, and just monitoring their condition. And so when an individual can't really tolerate the contrast shower anymore, then this is something that we move to next. And sometimes they don't like the hot foot bath, so we'll just do the chest components and do chest fomentations on them as well. Now, individuals sometimes will have lung involvement where they start developing a productive cough, and it looks like you might be developing maybe a secondary pneumonia or something of that nature. Well, when that's the case, then what we'll usually use is an onion poultice. And so you'll get an onion, blend it in a blender with just as much water as you need to, just enough to get it blended. You don't want it really wet and runny. And then you get plastic wrap, like food wrap, put it on the counter, put some paper towels on top of that, smooth I put the onion on top of the paper towels, and smooth it out. Put paper towel on top of that, and then you stick it on the chest of the individual, and then secure it in place, whether with tape or with additional plastic wrap around the chest, tight-fitting shirt, or other things of that nature, and then keep it on for about at least 4 hours, sometimes overnight. And that tends to be quite beneficial. Also, deep breathing is really beneficial. We have 4-7-9 breathing that we instruct individuals with. So breathing in through your nose for a count of 4, holding it for a count of 7, breathing out through pursed lips for a count of 9. And so you breathe in for 4, hold 7, out for 9, in for 4, hold for 7, out for 9. You repeat that about 10 times, and then repeat that every hour that you're awake. And that helps with that oxygenation and lung function. Now, sometimes we have individuals that have gotten to the phase where they don't have a lot of productive cough that's going on, but we can see their oxygen levels starting to go down. And the concern at that point is that an individual is starting to form micro blood clots in the lung, and it's starting to then affect lung function. And so there are some natural anticoagulants that we use in those cases. For example, nattokinase, about 200 milligrams a day. In addition to that, about garlic oil, about 2 capsules 3 times a day. You really don't want to do that without food because it's kind of hard on the stomach. Ginger powder, about a 1/4 teaspoon 3 times a day. Grape juice also has a benefit too, and Welch's is the whole grape, so about a cup of that 3 times a day, and then some evening primrose oil at 1,000 milligrams 3 times a day as well. So you see it's mostly 3 times a day except for the nattokinase. But you do have to watch out. We have had one individual that started developing petechia, which is little tiny purple spots under the skin that indicates that there's little bleeding that's going on under the skin, and they were actually too anticoagulated. And if that was the case, well, we backed off on the evening primrose oil and the nattokinase, cut the garlic down in half, and then continued the ginger and the Welch's grape juice, and that cleared by the next day. And so it is effective. If you're developing petechia, then it definitely is effective in anticoagulation. And then when individuals are looking at recovering, you got to make sure that you rest. What we have found is that many times individuals try to get back into the regular activity too soon. And when they do so, they relapse. And so they'll start having fevers again. They'll go down quite easily. And so I recommend at least 42 to 72 hours after your last symptom is gone before you really get back into normal activities again. Start those contrast showers up again. Limit the amount of work that you do. Spend as much time outdoors in the fresh air and sunshine, and make sure you have that cheerfulness of mind. And all of those are going to be beneficial for you. Of course, God wants us to be in health. He said, "Beloved, I wish you above all things that thou mayest prosper and be in health, even as thy soul prospereth." Now, for more details, again, you can go to uchpines.org/COVID-19. And there is an 11-part series that's on there called Lessons from COVID. And I think that would be very instructive for many of us to understand what's going on, why we're seeing the responses like we are, and what context that it's coming in. And so that's what I have to share at this time.
Dr. Sandoval, that was phenomenal. Absolutely phenomenal. And I'm going to share something with our viewers. Dr. Sandoval helped me yesterday, personally. I don't have time to share everything about what has happened to me, but I too have unfortunately participated in the COVID Delta surge. And Dr. Sandoval, yes, everything that he said, it absolutely does work. And I cannot encourage you enough that what he said works.
But the point is, those who are COVID recovered have robust, complete, and durable immunity without significant risk of reinfection. If we would have seen significant reinfection, it would have been apparent by this point in time. So I think that's the group of individuals. Whether somebody's gone on to take the vaccine or not, that's the group that really can be rest assured. But for those who have either taken the vaccine or haven't, it's possible that the Delta variant could come knocking at your door, and I want you to be prepared for it. So if we can bring up the slide, we have an updated treatment algorithm. Here's a treatment algorithm. So look at the very top here. If COVID-19 is diagnosed with either PCR or antigen testing, the white box. That's the time to actually get home, self-quarantine at home. If you're at work or school, do put on a mask and go ahead and get home. We ask that you go ahead and start now. This is new. Povidone iodine, that's betadine. That's the brown liquid that doctors use to sterilize wounds. Just put a few drops in a glass of water, small glass of water. I mean, very, very dilute, just to turn the water brown. And go ahead and swish and spit that out. Don't swallow it. And also, you can either use a nasal dropper or just use a Q-tip, and also do the nose with that at least twice a day. And acutely sick, we can increase that to 4 times a day. But we're now recommending, like they do in Singapore and so many other places, povidone iodine as general nasal and oral hygiene for prevention, and then an active treatment to cut down the viral loads. With the Delta variant, we know that the Delta variant individuals are carrying about 250 to 1,000-fold viral load of the previous variants. It's one of the reasons why Delta is such a big issue for us, is people who have it carry so much of the virus. Do contact tracing, reduce your contagion. That is, have people sleep in separate bedrooms, and open the windows and doors. You know, it's fall time. It's starting to get cooler. Ventilate your house with fresh air. Do not try to stay in a room and keep breathing the air. If you can get outside, spend as much time outside as possible when you're sick with COVID-19. Now, age under 50, no other medical problems. We recommend a nutraceutical bundle, as you can see there: zinc, vitamin D3, vitamin C, and quercetin in the doses. You should have those on hand at home. Those are easy things to buy on Amazon, along with your betadine. And then watchful waiting and you complete self-quarantine. Our CDC says now, if it's 10 days from the onset of your illness and you don't have any symptoms in the last 48 hours, you can go back to work. No test is needed. Now, if symptoms worsen, then we move into the treatment algorithm, and we do feature the Regeneron antibody, carasivimab, indimab infusion, and these are available in all major metro areas. Make sure you know what hospitals and urgent care centers carry the monoclonal antibodies, and try to use these on day 1, 2, and 3. I just had 2 of my patients yesterday get it on day 1, and I can tell you, if you can get it on day 1 or 2, they're going to do great. Clearly, those over 65 with medical problems are your highest priority patients, but younger individuals with severe symptoms or medical problems, also keep them in mind for an antibody infusion. After that, we can move into 2 anti-infective agents. If you've used an antibody infusion, it's not so mandatory that you use hydroxychloroquine or ivermectin. You can simply add the doxycycline and azithromycin and move on. But if you haven't gotten a monoclonal antibody infusion, you probably do need the 2 antivirals. It's either hydroxychloroquine, 200 milligrams twice a day, supported by over 250 studies, or ivermectin at doses that are typically now 18 to 36 milligrams in doses over the course of about 5 days or so. And that's supported by over 60 studies. Again, we add azithromycin or doxycycline for additional benefit. Inhaled budesonide should be ordered now in all of these patients over 50 with medical problems, 800 micrograms twice a day. It's a Pulmicort inhaler or nebulizer. And then steroids. The most common steroid use is prednisone. The most common dose now is 20 milligrams twice a day with a taper. And don't forget colchicine, 0.6 milligrams a day for 30 days. Patients with additional risks for blood clotting, and keep in mind, when the oxygen saturation goes down, that's blood clotting. That's not the virus, that's blood clotting. We do recommend for all adults now aspirin 325 milligrams a day, starting at the beginning of illness out to 30 days. Patients with atherosclerosis out to 90 days. And then our high-risk seniors, go ahead and put them on Lovenox or low microweight heparin, 1 milligram per kilogram twice a day, or start oral Eliquis or Xarelto or Pradaxa, one of our standard oral anticoagulants. Keep in mind the shortest duration of treatment is about 5 days. Average person about my age, so say people in their 60s or 70s, would be 10 days. And then a high-risk senior citizen, someone in a senior home, people with elderly, multiple problems, figure on 30 days. It's a long illness. We have oxygen concentrators. You can make a phone call to a medical supply company, and with the current emergency orders, they will get the oxygen concentrator out to the house ASAP. That can help people and reduce some of the anxiety. This type of program, as described, seems complicated, but it's about 4 to 6 drugs in sequence combination. No single drug is essential. So right now in some of the countries, ivermectin is being curtailed, or hydroxychloroquine was being curtailed. It's honestly not a big deal. We can operate this algorithm without ivermectin or hydroxychloroquine and still provide high quality care. It's been shown that this algorithm can reduce hospitalization and death by about 85%. But it does take dedicated doctors to do this. We need to have more doctors coming off the sidelines and doing this. One of the reasons why we're promoting the monoclonal antibodies so much, because they are FDA, EUA approved, and giving monoclonal antibodies should get some of our bigger health systems and clinics in the game of early ambulatory treatment. So I'll stop here and let you go ahead and take over.
Dr. Margaret Song is a classmate of mine. We went to medical school together. She's an internal medicine and preventive medicine specialist. And we are excited to hear from Dr. Song, who has been treating on a regular basis many COVID patients. Dr. Song, can you tell us a little bit for the next few minutes about some of these things that you've been incorporating in your practice and how God has given you not a spirit of fear with COVID, but a spirit of love?
Thank you, Leela. Yes, I've been having the privilege of treating many COVID patients in the outpatient setting. Since mid-December of last year, I have been using medications such as ivermectin. It's been a key part of my outpatient arsenal. And I'm happy to say that I have not had anybody end up in the hospital, and I have not had anybody die with COVID if we were able to start early treatment within the first week or so of symptoms. However, I am seeing that pharmacists are beginning to block my prescriptions for ivermectin. Just yesterday, I was on call and trying to treat a scared mother who herself had COVID and her 15-year-old son, and the pharmacist refused to fill the prescription. Well, we found a way around that situation eventually, but I realized that I need to, perhaps going forward, rely more and more on other methods as well. I want to share some of the things that I've been doing with my patients that have been very successful in helping them to get well sooner. Even before I started using ivermectin last December, I was using most of these other, or many of these other modalities already, and having success in keeping people out of the hospital. So I tell them to be on a simple diet. Actually, diet is really key to helping to strengthen your immune system. So I tell them no sugar, no dairy, and no meat. We have data showing that a plant-based diet actually results in better outcomes with COVID. So I have them basically eating fruit, a very light diet, lots of water. I tell them to go outside. Don't wear a mask inside your home. I was surprised to find out how many people were actually doing this. And go outside, get sunshine, sit outside in your patio, even if it's in the shade. You have volumes of fresh air circulating. And then I do a couple of things that most people can do simply in their homes. One treatment that's actually an old remedy, old folk remedy, but there is some scientific basis for doing this, is using an onion poultice. I had a relative of mine and a couple of other people. I've been doing some house calls as well on weekends. And I've been amazed at how quickly people's chest tightness and shortness of breath turns around with an onion poultice. So for a standard-sized man, I would probably use 2 large onions. For a small person like me, maybe 1 large onion would do. And I just chop it up and tell them to put it in a skillet, maybe with a tablespoon of water, and heat it up for a couple minutes just to soften it up a bit. And then let it sit and cool off for about 1 minute. And then either get a thin kitchen towel, or I like to use a pillowcase and just put the warm onions in there, and then put it on the bare chest of the patient while they're supine, lying down, and just kind of spread the onions around on the chest. And usually within 10 minutes or so, the patient does start to feel better. I've also been prescribing steam inhalation with essential oils like oregano essential oil. There's actually literature evidence for some of these oils as well as for the efficacy of steam. So I have people get a large pot and put about 3 inches of tap water in there, bring it to a boil, and then turn off the heat, remove the pot from the stove, set it on your table, and put about 2 drops of oregano oil in there, and then make a steam tent with a sheet covering your head and the pot, and inhale the steam with the essential oils in it for about 5 to 7 minutes. That could be very helpful, and you could do it two or 3 times a day as needed. I also, especially early on when people are having fever, body aches and chills, headache, the virus is in its rapidly multiplying stage in the illness, this is a wonderful time to hit with some heating treatments. It's very important that the patient not take any antipyretics if they're going to do a heating treatment. So try not to have Tylenol in your system or Advil within several hours before or after the treatment, because we don't actually want anything to block the fever generating ability of the heating treatment. We actually want the treatment to raise your temperature. And of course, that's not going to happen if you've taken Tylenol. So the easiest way that I found is to have people just sit in a very warm bath. Have the temperature, maybe started out about a jacuzzi temperature, but then increase the heat, take it up to 110, 111, 112, 113 degrees. And the idea is to get you to sweat for about 20 minutes. So that would mean at least about a half-hour bath. I encourage them to have a basin of ice water next to them with a hand towel or washcloth in there that they could wring out and keep their face and head and neck cool. And you really need to heat up for about 20 minutes. Afterwards, rinse off with a cool shower. I would take the basin of ice water and just throw it all over yourself and finish off with that cold rinse, dry off completely, go to bed, drink some more water, go to bed, and rest for at least 1 or 2 hours. I personally do something called general revulsive fomentations. If I'm able to do a house call, using bath towels and a microwave, and it's a bit too involved for me to describe how to do it here, but it involves hot fomentation to the back while the patient's lying on top of that. Contrast fomentations to the chest, so hot on for 5 minutes. They're sweating under a blanket, their feet are in hot water, they're laying on an ice pillow, and then I do a cold friction rub with a towel wrung out of ice water for about 30 seconds in between the hot. I've got a new fomentation cooking in the microwave while the present one is sitting, and then I unroll the wet and heated fomentation into a dry towel, and that becomes the next fomentation. And I do 3 changes of that, and we finish it off with a cold rub down of the whole body, limb by limb. We don't want to get the patient chilled. So that's been very effective. Usually they sleep very, very well after that treatment. I've also been using some therapies on my patients who are suffering after getting the COVID vaccine. I've been using some activated charcoal internally and a substance called black seed oil or black cumin seed oil that has some very powerful anti-inflammatory and antioxidant activity. And I just saw some studies done on black seed oil in the treatment of COVID. In fact, there was a randomized controlled trial from Pakistan using black seed oil. They used 80 milligrams per kilogram of weight 3 times a day, and that would be about 2 teaspoons of it. And they mixed it with honey and did that 3 times a day. And it was very interesting to see those results. And I think I'm going to start exploring that. I want to show a couple of slides here. I'm going to have to screen share because, oh, there we go. Thank you, Chris. All right. So this is just regarding the effects of steam inhalation in relieving symptoms of the common cold. Next slide. an article here about carvacrol, which is the active ingredient in oils of oregano, and their antimicrobial properties.
Dr. Song, someone writes in, how about fasting in COVID? Have you noticed any benefit as far as fasting in COVID-19?
I have, both with family members and with people that I have recommended at least a partial fast. Maybe I haven't actually experimented with just a full fast, with nothing but water. I actually think that it's important for a healthy functioning immune system to get nutrients. So while I do recommend a very simple diet, oil-free, free of animal products and free of processed ingredients, I think that fasting from large meals, of course, most people don't really have an appetite when they're sick, so that takes care of that. But, at least a partial fast is helpful.
Thank you, Dr. Song. And I'll tell you from personal experience, when you have COVID, you don't feel like eating. And that's what Dr. McCullough already talked about. You just have no appetite. Something that I did that was actually very beneficial. I know some of the doctors that I associate with have talked about other treatments. I actually used oral charcoal. Do not do it less than 3 hours between your medications. Wait at least 3 hours between your medications. The charcoal will absorb your medications. But the charcoal was very beneficial to me with that kind of nausea and helping my appetite to come back.
I'm going to move on here. This is a study from Finland showing that people who sat in a sauna for 15 minutes actually had higher white blood cell counts. So the immune stimulating effects of heat, very important. I'm going to move on to the next slide here. This is a study showing that sauna bathing reduces the risk of getting respiratory infections. This is preventive. People who saunaed regularly, there was actually a dose response. So those that were doing this several times a week, it was more effective than those who were doing this just once or twice a week. And I want to move on to the next study here. This is hyperthermic treatment, and this is in vitro. So 20 minutes at 113 degrees Fahrenheit suppressed rhinovirus multiplication by about 90%. So there's some studies out there showing the effects of heat. I think I had one more slide. This is just regarding onions, Allium cepa. Actually, onions are a great source of naturally occurring quercetin. So I actually have my patients cooking a large onion with about 5 cloves of garlic and some salt, and simmering it for about 20 to 30 minutes, making an onion broth, and eating that. Onions have organosulfur compounds that can actually break up mucus and relieve the sensation of chest tightness. So with that, I'm going to thank you. So those are just some of the things I do personally early on in disease. And I've been very blessed to say that my patients have done very well with these treatments.
Thank you so much, Dr. Song. And I can personally attest, there's different ways of, just like all of medicine, it's an art. It's not necessarily just a textbook, it's an art. And there's lots of different ways of doing fomentations. We're going to have a whole show just on water treatment and some of the other things that Dr. Song has talked about. I do want to tell you all one thing. I practice in the hospital. That's my basis of medicine. And one of the aspects that the ICU patients, particularly in COVID, they will have them prone or laying on their abdomen. And I myself, having gone through COVID recently, found an opportunity where, in addition to the fomentations to my chest that Dr. Song was talking about, I actually laid prone or on my abdomen, put my humidifier down below my bed, and had my tent, if you will, over my head with I used eucalyptus oil. And I had that over, and I noticed a tremendous difference just laying prone. So there's a lot of simple things that we can do. And again, I believe these are words of encouragement and happiness